course is excellent because it gives you some sense of control.
I completely changed my way of thinking and my way of taking care of myself.
It has improved my lifestyle.
The best thing about the course is the fact it gives you an all-round management of your condition.
It made me feel different.
I think it will take me to the rest of my life, all the things I'm told.
Illness doesn't have to be a condition that devastates your life.
This has helped me so much. How could I help others to do the same thing? How could I get the word out? How could I spread the word that this course is actually a good course? My name is Susan. I'm an expert patients program tutor. Before I came along to the expert patients program to do the initial 6 weeks course, things weren't easy. I was struggling in looking after myself with two long-term conditions, one being arthritis of the lower spine and the other being sickle cell anemia, which is a blood disorder.
I'm Anna, and I've had my conditions for 15 or 16 years. It's been devastating because there's been an incredible sense of powerlessness and never knowing when I'm going to be ill, when I'm going to be able to walk even sometimes, when I could do things. And this has led to a lot of social isolation because friends and family don't really understand what it's like. I think accepting that certain things are not possible helps, and pacing myself. And this is where the course really helps. The expert patient program helps you to get a sense of how you can tackle things in small chunks and then make manageable commitments and follow through.
Yes, I was neglecting myself. I didn't really look. One of the most important things with diabetes is to take care of your diet. And I wasn't really following that. I was indulgent, I was eating a lot of food, lovely food. I'm so enthusiastic that I have now the possibility open to me are enormous, and nothing is going to stop in my perseverance in continuing to improve myself.
I came on the course because I'd been diagnosed with a little-known condition called Hughes syndrome. It helped me particularly with dealing with professionals, because before in my professional life as an old-fashioned physio, I'd always been told by the doctors what to do for treatments. So I was very much of the opinion that if the doctors told me what to do, they knew best. But by going on the expert patient program, I realised that by getting informed and having a responsibility for myself, I was able to change that attitude and go into the doctor in a more positive manner.
Well, before I went to the EP program, I was so isolated and I felt frustrated and hopeless. I knew I can manage my health, but I felt I'd lost the tools of managing life. And I blame things on my illness as well. Because I'm ill, I can't do this. But now I know the illness will not go away, but I still can do certain things.
My name is Rob Glenn. I came on the course really for two reasons. One, because of my own conditions, and two, because I'm a carer for my wife who has rheumatoid arthritis and is recovering from breast cancer. Well, the good things I took out, I believe, would be to take a more positive or objective look at my own condition and the way I look after my wife to try and improve it, and not necessarily to look at a cure for my own condition, but a much better way of managing it.
Because of the EPP course, we set goals, and my goal, and my friend and I, we used to walk. I quite lost a few pounds, so I really feel much better in myself. Well, I started taking the medication as properly now with the dosage out there, and I really get a lot out of it. And even cut down on some of the things that, the food I eat as well.
things that have changed for participants taking their medication is that we've found that it has been reduced, it can be reduced. The benefits I see from beginning to end is just a dramatic change. From week one, they come in maybe, as I said, sad, feeling down. Throughout a couple of weeks later, they're starting to pick themselves up, they're starting to look and think, wow, there is hope, there is, I can make a difference to my life situation, I can do something different, I can get out of this rut that I'm in. And by week 6, nobody wants to go home.
Oh, I think the expert patient program must go on. I recommend it to all sorts of people I'm meeting. Hospitals even who've got a sick relative or something. It's really, really good.